Assalamualaikum and good afternoon. Today I will present on microbiological specimen collection and handling for COVID-19. Specimen type and priority. For initial diagnostic testing for COVID-19, CDC recommend the following specimens for testing upper respiratory tract. For example, nasopharyngeal specimen, oropharyngeal specimen, a nasal mid-turbinate and anterior nares specimen. But what we accept here in our lab is nasopharyngeal specimen or oropharyngeal specimen. Preferably, we need nasopharyngeal specimen as it can avoid contamination from the oral flora. CDC also recommend testing lower respiratory tract specimen if available. For patients who develop a productive cough, sputum should be collected and tested for SARS coronavirus 2. The induction of sputum is not recommended, okay, because it can generate aerosol. When it is clinically indicated, for example, those receiving invasive mechanical ventilation, a lower respiratory tract specimen or bronchoalveolar lavage should be collected and tested as a lower respiratory tract specimen. Before specimen collection, the clinician must wear proper personal protective equipment, 3-ply surgical mask or N95, glove, gown or apron. Follow the guideline on donning and doffing the PPE. Perform hand hygiene before and after the procedure. And we need an adequately ventilated room with limited number of persons involved. And beware of aerosolized generating procedures. For example, sputum induction using hypertonic saline nebulizer and open suctioning of respiratory specimen. Collect the specimen as soon after onset of symptoms as possible. The chance of viral recovery is best during the first 3 days after onset and is greatly reduced with many viruses beyond 5 days. And use only synthetic fiber swab with plastic shaft. Do not use calcium alginate, wooden or cotton stick. It is not acceptable as it may inhibit PCR. Use viral transport media. Immediately transport the specimen on wet ice or cold packs to microbiology laboratory counter. If delayed transportation is expected, refrigerate the specimen at 2 to 8 degrees. Do not freeze the specimen. Okay. You may contact the virology laboratory at extension 6274 for any related query. A single negative test result, particularly if this is from upper respiratory tract specimen, does not exclude infection. Repeat sampling and testing, and also lower respiratory specimen is strongly recommended in severe or progressive disease, and a positive alternate pathogen does not necessarily rule out either, as little is yet known about the role of co-infections. How to collect upper respiratory specimen? First, we will learn about oropharyngeal or throat swab. Okay, we use a tongue depressor to depress the tongue. Okay, be careful not to touch the tongue, side or top of the mouth with the swab. Hold the swab and with a sweeping motion, swab the posterior pharyngeal wall and tonsillar pillars. Ask the subject to say ah to elevate the uvula. Avoid swabbing the soft palate and do not touch the tongue with the swab tip. Place the swab immediately into a sterile vial containing VTM and break the applicator stick off near the tip to permit closure of the lid. Label the specimen container and not the cap as it may get switched during handling of the specimen, and send the specimen immediately at 2 to 4 degrees Celsius within 48 hours. For collection of nasopharyngeal swab, till the patient head is about 70 degrees and a sterile swab is passed gently through a nostril until a slight resistance is met. Leave it for a few seconds to absorb the secretion. Rotate the swab slowly over surface of posterior nasopharynx 2 to 3 times and remove swab and place the swab immediately into a sterile vial containing VTM and cut with scissors. And you must label the container and not the cap because the cap may be switched during handling, and you can send the specimen immediately at 2 to 4 degrees Celsius within 48 hours. The specimen for COVID-19 can be from ILI case, influenza-like illness case, or SARI case, severe acute respiratory infection case. For ILI case, okay, these are the specimen that can be sent: nasopharyngeal swab, throat swab or oropharyngeal swab, and also sputum, because sometimes in ILI patient, they may have the involvement of the lung as well. Next, for SARI case, these are the specimen, basically from lower respiratory tract, okay. And the specimen that can be taken are nasopharyngeal swab and throat swab in VTM, nasopharyngeal aspirate, bronchoalveolar lavage, tracheal aspirate, and ETT aspirate must be put inside the sterile container. All specimens must be transported to the designated laboratories at 2 to 8 degrees Celsius within 48 hours after collection. These are the video from UKJ. Okay, you can see later on how we collect the specimen, nasopharyngeal swab specimen. This is the triple packaging system. Okay, in triple packaging system, okay, it consists primary container, secondary container, and tertiary container. Okay, primary container is basically the specimen container, okay, and it must be wrapped with gauze, okay, as shock absorbent and to prevent leaking. Secondary container here, okay, and then the tertiary container is mainly our polystyrene box, okay. These are the primary container, the VTM bottle or sterile container. The secondary container is the white bottle, and the tertiary container is the polystyrene container. And we need also ice pack to maintain the temperature inside the triple packaging system 2 to 8 degrees Celsius. This slide shows triple packaging for COVID-19. Step 1, you have to label VTM bottle or sterile container according to patient's name, RN, etc. And then after collection of the specimen using the Dacron swab, cut the swab following the length of the tube so that it can be closed. Samples like bronchoalveolar lavage, nasopharyngeal aspirate, and ETT secretion, you have to put inside the sterile universal container. Okay, and then you have to seal with parafilm the VTM bottle or the sterile container to prevent leakage of the specimen, and wrap the specimen, which is the primary container, with gauze to prevent leakage and to absorb vibration. Next, place the primary container inside biohazard plastic. One specimen for one biohazard plastic to prevent cross-contamination. And later you place the biohazard plastic with the specimen tube into a secondary container, this one, and close it tightly. And step 7, you place the secondary container into a tertiary container, cool box or polystyrene ice box in an upright position. Fill in adequate ice pack or dry ice surrounding the secondary container. Close the tertiary container, and if needed, seal with black tape. Okay, and then you may put the polystyrene box inside the yellow biohazard plastic. Send immediately to the laboratory. Fill in the lab request form in 2 copies. Fill in the name, RN, IC, date of request, gender, age, occupation, and before sending the specimen, kindly contact the on-call microbiology MO at extension 4006 or 4004 or 4040. Fill in the comorbids and the date of onset of the symptoms, any history of traveling, international travel within 14 days, domestic interstate travel within 14 days, attended event associated with COVID outbreak within 14 days, exposure to confirmed positive COVID-19, contact to PUI. Also, fill in the signs, okay, the temperature, the radiological finding, the lung finding, white cell count, okay, chest X-ray or CT thorax if available. And then must fill in the type of specimen, either nasopharyngeal swab or oropharyngeal swab. Fill in the name, signature of MO, and then requesting clinical specialist name and signature, and most importantly, the specialist contact number and email address must be present. This is the flowchart for laboratory testing for COVID-19 in Hospital USM. Currently, we just accept nasopharyngeal swab or oropharyngeal swab. And nasopharyngeal swab is preferred compared to oropharyngeal swab. Lab will provide one swab and one viral transport medium. Send the specimen in ice to the laboratory as soon as possible. Keep specimen at 2 to 8 degrees. Do not freeze. Transport specimen in triple packaging and send the respiratory specimen to Microbiology Laboratory USM. Ini adalah carta alih tata cara permohonan ujian COVID-19 di Hospital USM. Apabila pesakit memerlukan ujian COVID-19 daripada ward, pegawai perubatan ward perlu berbincang dan mendapatkan kelulusan pakar perubatan, dan pegawai perubatan ward menghubungi pegawai perubatan microbiology on call di sambungan 4006 ataupun merujuk kepada jadual on call, dan pegawai perubatan microbiology on call memaklumkan pakar perubatan microbiology on call, dan pegawai perubatan microbiology on call memaklumkan staf makmal untuk menyediakan kit spesimen COVID-19 triple layer packaging. The staf makmal akan menyediakan kit spesimen COVID-19 dan staf ward boleh mendapatkan kit spesimen dari kaunter makmal. Perlu menghubungi 4004 atau 4040 untuk memastikan kit telah tersedia, dan pegawai perubatan ward mengambil spesimen mengikut tata cara yang telah ditetapkan. Staf ward akan mengisi borang permohonan, memasukkan spesimen ke dalam triple layer packaging dan menghantar spesimen ke makmal. Hubungi makmal sambungan 4004 sewaktu pejabat dan 4040 di luar waktu pejabat sebelum penghantaran spesimen ke makmal.